Good morning. Everyone, I think, knows who's here. To my far right, Dr. Malatras, Dr. Zucker. I'm technically a doctor also, but not really. Melissa DeRosa, Secretary to the Governor. Robert Mejica, Doctor of the Budget. Let's talk about today's numbers and where we are today. Total number of newly hospitalized is up from yesterday, but when you look at the three-day averaging of these numbers, the three-day average is down, which is good news. This is the three-day hospitalization rate. We tend not to look at any one day. Day to day, it's up somewhat, but if you look at the three-day average, it's moving down, which is good news. We talk about the apex, and is the apex a plateau? And right now we're projecting that we are reaching a plateau in the total number of hospitalizations, and you can see the growth, and you see it starting to flatten. Again, this is a projection. It still depends on what we do, and what we do will affect those numbers. This is not an act of God that we're looking at. It's an act of what society actually does. Change in daily ICU admissions is way down, and that's good news. The daily intubations number is down, and that's good news. The discharge rate is right about where it was. The bad news is 5,489 New Yorkers have lost their lives to this virus. That is up from 4,758. That is the largest single-day increase. And we talk about numbers, but that's 731 people who we lost. Behind every one of those numbers is an individual, is a family, is a mother, is a father, is a sister, is a brother. So a lot of pain. Again today for many New Yorkers, and they're in our thoughts and prayers, many people across this country. Why the discrepancy or the discordancy, number of deaths up, number of hospitalization dropping, the number of deaths, number of losses is a lagging indicator to the number of hospitalizations, right? What happens is a person goes into the hospital. If they're treated, most of them are then released, they're discharged. Some stay, some get put on a ventilator. The longer you are on a ventilator, the less likely that you will ever come off that ventilator. And that's why you're seeing the number of deaths increase, because these are people who came in at the peak. They were not successfully treated. They're on a ventilator. The longer you're on a ventilator, the less likely you come off the ventilator. New York is still the most heavily impacted state in the nation. New Jersey, which is on the curve a little bit behind New York, is suffering. And again, our thoughts and prayers are with them. I spoke to Governor Murphy of New Jersey today, and we talked through the situation and working on joint strategies, but our heart goes out to all of our neighbors in New Jersey, Michigan, California, Louisiana. In terms of how we're operating, how we're managing the situation. As we know, the hospital system basically is a three-legged stool. It relies on number of beds, number of staff, and the equipment. Number of beds, we have started with a system of about 53,000 beds statewide. We're up to about 90,000 available beds, so we have more than enough beds available. Staff has been a problem. Staffing, healthcare staff is getting sick. They're overworked, they're stressed, they're under great emotional stress. You know, think about these healthcare workers. You're working in a hospital, in an emergency room that's overwhelmed. You're worried about your own health. You then go home. You're worried about bringing a virus home if you're infected. At home is under stress, as every home is under stress. About 7,000 new staff have been hired from the pool that we have identified. These are retired healthcare workers who came forward. These are people from across the country who came forward. The state has a pool of potential employees. The hospitals hire from that pool, and they've hired about 7,000 to date. Equipment, that's the protective equipment, ventilators, where we are stretching and moving, but every hospital has what they need to date. And then we balance the patient load among all hospitals, so no hospital, single hospital or system gets overburdened. And that's a daily adjustment, which takes tremendous cooperation among all of the healthcare institutions. I thank them very much for what they're doing. And then we have the overload relief, which is the Javits Center, 2,500 beds, and the U.S. Navy Ship Comfort. The U.S. Navy Ship Comfort had 1,000 bed capacity. It was originally for non-COVID patients. What wound up happening was we don't really have non-COVID patients. Closed down society, there's fewer traffic accidents, crime is down. So the original plan, which was the Comfort would take non-COVID cases from the hospitals, didn't really work because the hospitals didn't have non-COVID cases. I called the president yesterday morning, asked him to speak to the Department of Defense to see if they would change it to COVID. President, to his credit, moved expeditiously, called me back yesterday afternoon, said they would make the Comfort non-COVID. COVID. When they make that transition, the capacity of the ship comes down from 1,000 to 500 beds because COVID patients require a greater treatment area, more space, and therefore the capacity of the ship came down from 1,000 to 500. It's still a tremendous benefit. So between Javits and the Comfort, that's 3,000 beds, which is a welcome overload relief to the hospital system, which is already extraordinarily stressed. But I spoke to General Shaughnessy today, who we spoke through the Comfort and Javits. The Department of Defense has been fantastic, and the number of military personnel they have sent up here and how quickly they've sent up here, and this is a tough assignment to run facilities this large and to come up to speed and to be handling this many COVID patients in a new startup emergency facility. This is a really difficult undertaking, and they've really been fantastic, and I want to thank them all. And I want to thank the President for moving as quickly as he did. We're working on a TriState Cooperative. As I mentioned, I spoke to Governor Murphy from New Jersey. I spoke to Governor Ned Lamont from the state of Connecticut. We coordinated the shutting down, if you will, when we did schools, businesses, et cetera, because this really operates as a tri-state area. A lot of people who live in New Jersey, work in New York, or live in New York, work in New Jersey or Connecticut. So we talk about the tri-state area, which is true, and we try to operate to the best we can as that regional collaboration, and that has been working well for us on schools, on the economy, on healthcare issues. We have to start planning, restarting life. We're not there yet, but this is not a light switch that we can just flick one day and everything goes back to normal. We're going to have to restart that economy. We're going to have to restart a lot of systems that we shut down abruptly, and we need to start to plan for that. And I spoke to the governors, Governor Murphy and Governor Lamont, about coming up with a regional, metropolitan, tri-state approach to do just that. How do we, when we get to that point, which we're not at, but how do we restart our economy and get everything up and running as quickly as possible? My personal opinion is going to come down to how good we are with testing. You're not going to end the infection and end the virus before you start restarting life. I don't think you have that luxury. How do you start the economy back up? How do you start getting back to work as quickly as possible? It's going to come down to testing. You're going to have to know who had the virus, who resolved the virus, who never had it, and that's going to be testing. And that is an entirely new field that we're just developing now, right? New York State Department of Health developed an antibody testing regimen that Department of Health has approved for use in New York State. That has to be brought to scale, and the Department of Health is going to be working with the FDA to do just that. This tests the blood to determine whether or not you have the antibodies, which means you had the virus and resolved the virus. That's why you would have the antibodies for the virus. That would mean that you're no longer contagious, and you can't catch the virus because you have the antibodies in your system, which means you can get to work, you can go back to school, you can do whatever you want. But you have to have that testing, and you have to have that testing on a scale, right? You have 19 million people in the state of New York. Just think of how many people you would need to be able to test and test quickly. So the antibody testing is part of that. Also, rapid testing to determine whether or not you have the virus now exists. They have, quote unquote, 15-minute tests that are commercially available. But again, they have to be brought to scale. No private company has the capacity to bring those to scale. So I was speaking with Governor Murphy and Governor Lamont. We are interested in working with private companies that can actually bring this testing capacity to scale, and to scale quickly. Because again, if you have the antibody testing, that's part. If you can then test if a person is positive for the virus, and you can do it that day, and you can get those results in 15 minutes, that's also another way to get back to life and do it quickly. So we're very interested in that in New York, so is New Jersey, so is Connecticut. There are private companies that have these tests. Again, it's all up to scale. We're starting them in the state of New York, but we only have about a 50,000 person testing capacity, which is nice, but it's not of a scale that's actually going to make a large difference. So private companies that are interested in getting into this space and coming up to scale quickly, we are interested in those companies, and we're interested in investing in those companies, and they should contact us at Empire State Development Corporation. Also restarting life, the state budget, not just this state, but every state budget has been decimated by this situation. You shut down the economy, people aren't working, they're not paying income taxes, businesses aren't operating, so our budget just collapsed, right? Our revenues just collapsed. You want to restart the economy, you have to help restart the local governments, and that's going to be a federal act. I don't have the capacity as a governor, no governor does, to generate revenue in a positive way from an economy that's not operating. That is going to be a federal stimulus bill. There's no other way to do this. And it has to be a stimulus bill that actually understands you have state and local governments that have to be brought up to speed and functioning if you want to facilitate this restarting of the economy. Federal government passed some legislation. As I've said at the time, it was woefully inadequate from New York's point of view. We then have had some time to actually study the legislation. It actually gets worse when you read it, and it's not even what was represented to us initially. So I'm sending our congressional delegation a letter today saying the past legislation did good for the nation, I have no doubt, gave aid to a lot of people and places that needed it. but it was not fair to New York, and that has to be remedied in any legislation that goes forward. The last point, I know it's been a frustrating 37 days, but it's only been 37 days on the other hand. I know it feels like a lifetime. It's been so disruptive, so abrupt, so frightening, so disorienting, but it's only been 37 days, right? Everything in context and everything in perspective. I know it's tough to get up every day, and this is like Groundhog Day, living through this bizarre reality that we're in. It's even more difficult, I think, with the weather changing, and you feel the seasons changing, and it's getting nicer, and you start to open a new book of possibilities, and now the weather's getting nice, and I should be getting outdoors, and I should be doing this, and I should be doing this. I get it. But it's only been 37 days. And I started by saying those numbers of cases, that's not arbitrary. What we do affects the number of cases. Our behavior affects the number of cases. We're generating the cases. They're not descending on us from heaven, right? It's our behavior. So it's been 37 days. The 1918 pandemic that we talk about peaked in New York for 6 months. It came through in 3 waves, and it peaked for 6 months. 30,000 people died in New York during that pandemic. Why? They didn't react the way we did. They didn't know as much as we know today. They didn't have the same drug therapies. But we are changing the curve in that virus growth. You see that plateauing. That's because of what we are doing. If we don't do what we are doing, that is a much different curve. And that's what happened in the past. So social distancing is working. Well, you shut down all the businesses. I know. Well, you shut down all the schools. I know. But it is working. That's why you see those numbers coming down. If we were doing the same rate of interaction, those numbers would still be going up. So to the extent we see a flattening or a possible plateau, that's because of what we are doing, and we have to keep doing it. I know it's hard, but we have to keep doing it. And to the extent it takes an effort, remember at this time, it is about we, and it is not about me. I know what I would like to be doing. I would like to be going, it's motorcycle weather for me. It's time to get out on the water. It's time to go hiking in the Adirondacks. I get it. It's not about me. It's not about me. What I do will affect other people. It will affect my family. It will affect other people. It will affect people in those emergency rooms who are killing themselves every day to keep other people safe. I get infected, I will affect them. So we all talk about society and community and interconnection and interrelation and family, and life is bigger than us. Now is the time to live that, right? Now is the time to live that. So when you feel that need, I have to do this. It's not about me. It's about we and what's good for all of us. And my health is in your hands. And your health is in my hands. And the health of those healthcare workers and those first responders and all those people who have to show up to work every day to keep society functioning, we are responsible to them also. So to the extent it's hard, I get it. But maybe if we think about it through a different lens, a broader lens, it'll be a little easier. So let's not get complacent. We have to stay disciplined. We have to stay smart. We have to stay safe. And we do that by staying at home. And we will get through this together. Questions?
The Pentagon said yesterday that